Happy Wednesday, my friends. Welcome back to another job lead video. We have made it halfway through the week and the job leads have been really good this week. I am hoping that continues throughout the rest of the week. But you have been asking in the comments for more non-phone healthcare jobs that do not require any college degree. So that is what we are doing today. I have 7 fresh new job leads for you that are all in the healthcare field that don't require any college degree. These are all non-phone based. Before we get started, I do just want to ask if you would leave in the comments if you're interested in any phone-based healthcare jobs at all. The healthcare field is massively growing and there are a lot of open positions right now, customer service, and some of the phone-based positions are not taking inbound calls. They're more like on the insurance verification side or patient scheduling side, or payment collecting. So you're actually calling the patient or calling the insurance companies and making outbound calls. If you're interested in seeing any of those positions, please leave it in the comments down below. Also, if you find this video or any information in it helpful, please give this video a thumbs up like button. That gives me feedback that these videos are actually helpful. But without further ado, let's just dive on in. First up, we have Teledoc Health. Now, Teledoc is a completely over-the-phone telehealth medicine company, and they are hiring a credentialing specialist. So the credentialing specialist will be responsible for credentialing and re-credentialing and licensing physicians and assisting with other various duties. So some of the responsibilities are to participate in credentialing and re-credentialing activities. You assist with payer enrollment applications and updating the MPI database. You will initiate state license applications and processes until issued. You assist with uploading the physician applications and entering new physician data into the credentialing software. You'll review the physician applications for accuracy and verify that all the documents have been received, and you'll serve as the single point of contact for the assigned physicians, and you'll have to review provider credentialing files for submissions to clients. Now, in the healthcare field, every insurance company requires physicians to be enrolled and credentialed with them. So if they are serving patients that have UnitedHealthcare insurance, they have to be enrolled and credentialed with UnitedHealthcare. If then they want to see a patient that has Blue Cross insurance, they then have to be enrolled and credentialed with Blue Cross. So you may have the same physician and you have to submit applications for their enrollment to every single insurance company. And so that is what this position is doing. They are looking for someone who has excellent customer service skills. Payer enrollment experience is desired, but not required. Previous experience with medical licensing processing is desired, but not required. They do require someone who can work independently, who has strong organizational skills, strong computer skills, and the ability to deal with difficult clients and situations. They would like someone who has 4 to 6 years experience in a medical office setting or credentialing physician in a telemedicine environment. And the base salary range for this position is anywhere from $40,000 to $60,000 a year. This does say it is remote for the entire United States. Now, just a little disclaimer, I do not work for any of these companies. The only information I know is what they put in the job descriptions. I am simply just sharing what I find while searching all the interwebs. And if there is no state restrictions listed in the job description, I do share, but there is a possibility at some point that I may share something that is restricted to certain states. But if it is not stated, there is no way to know until you reach out to them. Moving right along, UnitedHealthcare's UnitedHealth Group is hiring a remote FMLA claims specialist. Now, one thing to note about UnitedHealthcare is there are a couple of jobs from them in this video. They are on a massive hiring spree right now. They have everything open from customer service, the outbound phone call positions I was talking about, like insurance verification and patient scheduling and patient assistant. And then they have the non-phone based positions open, like billing FMLA claims representative, payment posting, all kinds of things. So if you are looking for a remote healthcare position, it might be wise to go to their main career page and just look at everything they have open. So this does say you'll enjoy the flexibility to telecommute from anywhere within the U.S. and take on some tough challenges. So this is a full-time position. Employees are required to work normal business hours from 8 a.m. to 5 p.m. and occasionally you may be asked to work overtime or weekends, but that is not the norm. The primary responsibilities of this job is to process a variety of leave types to assist members. So FMLA is the federal program that if you have a medical condition, your doctor can fill out forms and you can submit to get FMLA clearance. And if you have that clearance, you can be out because you are sick for medical appointments. You can be out of work to take care of family members or children that are sick or have medical issues and conditions, and your job is kept for you and safe while you are out. They cannot fire you for being out too much. The FMLA is the federal guidelines that does protect your job. And so you'll have to adhere to the federal, state, and company guidelines. You'll analyze and identify trends and provide reports as necessary. You assist with resolution of escalated claims to resolve complex issues for team members and internal customers, and you'll provide effective customer service while interacting with members and employers. It says telephonically, but most of this is just processing the paperwork and the applications for FMLA. It does require either a high school diploma or GED or equivalent years of work experience. So no even high school degree is needed if you have enough work experience. They would like someone who does have 6 months experience with FMLA claims processing and someone who's 3 years of experience in a related environment. That can be office work, administrative, clerical, customer service, using phones, computers as primary job tools. They just want someone who is experienced with computers and Microsoft PC applications. In the healthcare field, because of HIPAA laws and the sensitive information that you will be dealing with, you are required to have a dedicated work area that is established and separate from other living areas in your house that provides information privacy, and you need to be living in an area that can get high-speed internet connection. Now, certain states like Colorado and Nevada have laws that companies that hire from them have to post the salary range. Other states in the United States have not done this, so these pay ranges are for those states, but this job can pay anywhere from $17 an hour all the way up to $33.41 an hour, and that is based on location plus experience. Now, this next position is still in the healthcare field, but it is in the dental world. I tried to get a little bit of mix of everything. So North American Dental Group is hiring a revenue cycle specialist remote to work from home, filing dental claims. Now, some of the responsibilities of this job are processing dental claims for payment by insurance companies to ensure appropriate timely coding, billing, and collections. You'll perform manual and electronic posting functions for all payers and patient accounts. You'll post payment corrections and transfers. You'll research and clear unapplied accounts. You'll maintain knowledge of the insurance rejections and denial processing and appropriately post that information to patient accounts. So you'll be following up on the patient's account from the time it is billed out to the insurance company, from collection of that. You will also post the payments to the account when they come in. So you may occasionally have to pick up the phone and call the insurance company, but this will be rare because you'll have access to the payer websites. So most of this is done online, identifying issues and trending for denials. The healthcare world has really went, especially since COVID hit, to paperless processing. Most things can be done online through a secure portal. I even work in my career with some insurance companies that have like the live chat function, so I don't even have to pick up the phone and call. If I have a question for a UnitedHealth rep, I can sit there on their website and do the chat box and wait for a rep to respond, and I have double monitors, and I can be working on a different patient's account on my other monitors. So most of this is done online. You will sometimes have to verify insurance benefits utilizing the website, fax, and possibly phone if you can't get anything out of the website, and you'll have other responsibilities as assigned. Now, for minimum qualification, they only require a high school diploma or equivalent. No college degree is required. However, they are asking for 3 to 5 years of dental or medical experience. So your medical experience can be anything from office administrative, front desk functions. If you've ever worked in the medical field, you can use that. They do prefer someone who has prior experience in dental office workflows or revenue cycle functions, including scheduling, registration, insurance verification, claim submission, charging, coding, insurance AR follow-up. So again, any experience in the healthcare field is transferable to this job. They do want someone who has strong organizational skills and the ability to work in a team setting. Now, some of their benefits, they offer paid time off, a benefit package including 401k, and growth opportunities. Unfortunately, the pay for this position is not listed. Moving right along, Piper Companies is hiring a benefits verification specialist to work remote. Now, Piper is Clinical Solutions. They are seeking a benefits verification specialist with a medical background to work for their global clinical research organization. So research is a little bit different than regular sick visits. This is a Monday through Friday, 8 a.m. to 5 p.m. working position. And I did include it because even occasionally you may have to pick up the phone and use the phone. This is going to be 99% non-phone based. Insurance companies now allow you to verify benefits online or through other methods. So your responsibilities will be to assist patients, pharmacies, pharmaceutical companies with reviewing medical records, benefit questions, billing reimbursement, insurance claims, appeals, and product complaints for clinical trial subjects. You'll coordinate with the patient's medical providers and pharmaceutical company representatives, and you'll collect and enter data, review insurance claims and appeals. You'll verify insurance, and you'll communicate with pharmacies or any other thing that is needed. They are asking that you have at least 1 year experience in a professional medical environment such as primary care, hospital, health insurance, medical billing call center, that you have excellent written, verbal, and communication skills, organizational skills, and that you have very strong computer skills. Now, they do offer a benefit package that includes medical, dental, vision, 401k plans, all the norms, and they pay $18 to $22 an hour based on previous salary history and experience. Now, back to UnitedHealth and Optum. Optum is owned and a part of subsidiary of UnitedHealth. They are hiring for a credit balance clerk remote nationwide. So this is anywhere in the United States. Credit balance work is some of the most challenging but fun work if you love math. So a little bit about credit balance. It is when a patient's account goes into the negative. The goal of getting insurances to pay a claim is to take a patient's account from owing money to having a zero balance. But sometimes either contractual adjustments or write-offs get posted that are incorrect amounts, or insurance companies do occasionally overpay. Sometimes things just happen that puts the patient's account into a negative balance, and the challenge is researching and finding out why. Was there a mistake made, or did the patient make a payment on the account and then the insurance came back and paid in full, so now the account is double paid and you need to refund somebody? And then in that case, who do you refund? The patient or the insurance company? It's all this fun challenge researching game. So this position is full-time, 40 hours, Monday through Friday, 8 a.m. to 5 p.m. You do have the flexibility to telecommute anywhere within the United States. And some of the primary job responsibilities will be to review and analyze the accounts, work queues, and reports to identify and resolve unapplied credits and credit balances issued by insurance companies or patients that result in the resolution of the credit and initiating a take-back or a refund. You'll respond to standard requests. You'll solve routine problems. You'll review all the account information from the explanation of benefits or remittance advice from the insurance company, the payments, the adjustments, the patient payments, all of that stuff. You'll just be analyzing everything to see if you can fit the puzzle pieces together and figure out what happened and why more money was posted to this account than should have. So for this position, they do offer a standard benefit package of paid time off, medical, dental, vision, 401k plans. They offer employee discounts and assistance programs and all kinds of benefits. They do require a high school diploma or GED, but no college degree is required. They would like someone who has 2 years experience or more in the revenue cycle or health, medical, billing, and collections, and 1 year experience in Epic is preferred. Now, Epic is a computer system that a lot of hospitals nationwide are starting to go on. The point of having all the hospitals and doctors' offices on the same computer system is they can very quickly see the medical history of a patient, and you can collaborate and send medical records and all at the click of a button, which is nice because say you are on vacation, say you have a heart condition, and you're being treated by your normal doctor and you're on certain medicines, which means there's other medicines you can't take that would interact with that. But then you're on vacation many states away from your normal hometown and you get in a car wreck or something happens. Now, how does that doctor that's seeing you, that's never seen you before, know that they can't give you certain medical medications because of your heart condition? It's all because these hospitals are on the same computer system and that information is shared. It is a great life-saving tool. If you have access to your medical records in an online portal called MyChart, then your doctor is on Epic. They do also want you to have knowledge in Microsoft Office, Word, Excel, all of that. Now again, the salary range is only posted for certain states, but this job goes anywhere from $16 an hour all the way up to $29.60 an hour. I know this video is getting really long. I am sorry. I just like to give detailed information, especially in the healthcare space, for those wanting to get started and in the door. The more prepared you are for an interview and go in knowing what you are talking about, the more likely you are to land the job. Health insurance companies are willing to train for the right person. But moving right along, we have Ivy Rehab Careers. They are looking for an authorization specialist, and this does say it is a remote position. So an authorization specialist is responsible for validating insurance eligibility and coverage and coordinating the benefits and authorization or pre-certification of services in their outpatient therapy setting. So you'll be contacting the insurance company's phone, fax, online portal, mostly online portal, to obtain insurance benefits, eligibility, and authorization information. You have to accurately enter information into the EMR or electronic medical record system to include therapy benefits, details, length of authorization, the total number of visits. You'll accurately document the patient's account to reflect all actions taken, and you'll document the patient responsibility for their insurance, including any copays, deductibles, whatever they are financially responsible for. You'll monitor their add-on appointments to make sure that they are still covered by their insurance, and you'll do annual re-verification for all of your existing accounts. Now, some qualifications for this are that you need prior experience working with either Medicare, Medicaid, or other governmental payers is a plus, but not required. They do want somebody who has the flexibility to respond to priorities and organize what's most important in your workday. Somebody who has the ability to multitask and strong customer service skills. Unfortunately, the pay for this position is not listed. And last but not least, UnitedHealth again has a cash applications representative hiring remote that you can telecommute anywhere in the U.S. Now, again, this is 40 hours a week, Monday through Friday, 8 a.m. to 5 p.m. They do not say what time zone that is in, but the primary responsibilities are perform research on various computer systems and document customer information regarding the status, payment expectations, notes of any conversations or interactions you have, and any other relevant information. You'll retrieve the electronic payment data from the insurance companies or when patient pays. You review and interpret that electronic data along with any paper EOBs that are probably scanned as PDFs into the system, verification of contractual write-off amounts, data entry, and balancing of payment data to patient accounts. You'll need to be able to reconcile monthly spreadsheets and balance them, and contact payers for any missing files or payments. This does require a high school diploma or GED, but no college degree, and only 1 year of customer service experience or 1 year of experience in an office setting environment. So either one, if you've never worked in customer service, if you've worked in an office setting, receptionist, there you go. You need to demonstrate the ability in using a computer and navigating through a computer on your own, and you need to be able to successfully complete the UnitedHealth Group's new hire training and the ability to work an 8-hour shift. Now, I'm not seeing a position from UnitedHealthcare, except for this one specifically state the ability to successfully complete the new hire training. So this seems like a very entry level position. So if you're looking to first time get your foot in the door, this might be the position for you. Now again, the pay will range depending on your location and experience, but this job can pay anywhere from $15 an hour up to $27.79 an hour. I know that was a lot, but I wanted to deliver the best healthcare positions and information about working remotely in the healthcare world that I could. If you've made it to the end of this video, I want to say thank you so much for watching and supporting me. My viewers and subscribers are awesome. Please comment down below anything else that you would like to see, and I hope you have a great rest of your day. 2 videos will be popping up on your screen. One I picked for you and the other YouTube picked for you that you might enjoy next. Please subscribe and hit the bell icon so you never miss another work from home or money making video from me. Thank you so much for watching, and I'll catch you in the next one.